Good morning. Now we shall discuss about the acid production in plaque. Fermentable carbohydrate and a carcinogenic plaque need to be present on a tooth surface for acid to form. The acid is produced by bacterial metabolism of the carbohydrate substrate. Acid production quickly follows once the sucrose diffuses rapidly into the plaque. In experiments, it has been found that after rinsing the mouth with a 10% glucose solution, the pH falls within 2 to 5 minutes, often to a level that is sufficient to decalcify enamel. The pH 5.5 is the level where the tooth enamel begins to decalcify. The pH level remains the same at a low level for approximately 15 to 20 minutes, even though sucrose may not be taken for furthermore by the bacteria and the surplus in the mouth is washed away by the saliva. A single sucrose rinse of a few seconds can cause demineralization lasting between 20 minutes and several hours. The pH returns only slowly to the resting level after approximately an hour. These changes can be seen in the so-called Stevens curve, which is shown here. In this graph, you are looking at two lines. The upper line is showing the changes in pH value after rinsing the mouth by 10% glucose solution in a normal healthy mouth, whereas the lower line shows changes in a mouth that already has caries. As you can see in the graph, the pH value is falling rapidly after glucose rinse within a few minutes, which is 2 to 3. This fall in pH is more in the mouth with caries, and the pH is reaching up to 4.5 as compared to the normal mouth where the pH reaches up to 5.5. For the next 15 to 20 minutes, the pH value is remaining at level which is more favorable for decalcification of the tooth enamel or caries initiation. The gradual return of the pH to baseline values is a result of acids diffusing out of the plaque. In addition, buffering in the plaque and salivary film exert a neutralizing effect. Saliva is very important in countering pH drops, and this is one reason why people with dry mouth are at high risk of active caries. It also explains how stimulation of saliva can help to counteract a fall in pH. There has been a vast amount of experimental work linking fermentable carbohydrate and dental caries. This work has proved that sugar is the most important dietary item in caries etiology. Thus, dietary advice has an important role in the management of the caries process in conjunction with oral hygiene and use of fluoride. The rapidity with which the pH falls shows the speed with which sucrose can diffuse into the plaque and the activity of the enzymes produced by the huge number of bacteria in the plaque. The fast recovery to the normal pH is an essential and critical factor for the prevention of caries development. But it is slowed down by these factors. Number 1. Rapid production of high concentration of acid within the plaque temporarily overcomes local buffering. Number 2. Escape of acid into the saliva is delayed by the diffusion limiting properties of the plaque and its thickness. Number 3. Diffusion of salivary buffers into the plaque hampered by the diffusion limiting properties of the plaque and its thickness. Number 4. Continued acid production from bacterial intracellular storage polysaccharides after dietary sugar is exhausted. The acids produced in the plaque are mainly lactic acid, but acetic acid and propionic acids are also present in small quantities. Of these three acids, Lactic acid is mainly responsible for caries lesions. When plaque is sampled after exposure to sucrose, lactic acid is predominantly found, particularly during the trough of the Stevens curve. Lactic acid has a lower acid dissociation constant, which is also known as pKa, and causes a greater fall in pH than equimolar solutions of acetic or propionic acids. Acid dissociation constant measures the strength of an acid. The lower the value of pKa, the stronger the acid and the greater its ability to donate its proton. Now we will talk about the minerals present in plaque. Salivary components also contribute to the plaque matrix in addition to bacteria and their polysaccharides. In plaque, calcium phosphate ions and often fluorides are present in significant amounts. There is little evidence that shows an inverse relationship between calcium and phosphate levels in plaque and caries activity or sucrose intake. The plaque has the ability to concentrate the calcium and phosphorus. This property of plaque is used in the preparation of mineralizing mouthwashes. The level of fluoride in the plaque may be high and may range from 15 to 75 ppm or more. The level of fluoride in plaque mainly depends on the fluoride level in the drinking water and diet. This fluoride is probably mostly bound to the organic materials in the plaque, but at low pH levels may become available and active in ionic form. This is the end of this presentation. I'll suggest that you subscribe this channel so that you can get any news about the new video upload. I'll suggest that you share this video with your friends so that they can also get the benefits. Thank you for watching this video. Take care of yourself. Have a nice time.